Hi everyone, I am Nurse Adorable and I welcome you back to Living Healthy with Nurse Adorable. In today's video, we shall be talking on kidney stone. Kidney stone, I know most of us must have heard kidney stone at what point or the other in our lifetime, and we might be wondering our kidney stone, kidney, yes, we have kidney in our system, then stone, that how come, what's the relationship between the two of them, and how possible can it be that we find stone in our kidney. So today we'll be talking briefly on kidney stone, and in today's video we'll be answering some questions. But before we go into details, I would like to appreciate everyone that has been watching my video, my subscribers, and those that are still planning or aiming to subscribe to my channel. I really appreciate you all. So just as I've said, that we're going to be answering some questions in today's video, in today's discussion. And some of those questions are: how does that stone find its way into the kidney? What is that stone made of? Will this stone hinder the functions of the kidney? How then can we prevent this stone from getting into the kidney? So these are the questions we are going to be answering in today's discussion. And also we are going to answer this question: how can we get rid of this stone when it gets into the kidney? So those are the questions we are going to be answering in today's health talk. So now let's start our discussion. Kidney stone. Kidney stone is a small hard deposit that forms in the kidney, and it's often painful when passed. Like when we are passing urine, when we are trying to urinate, if you have stones in your kidney, it causes pain. So kidney stones are hard deposit minerals and acid that stick together, mineral and acid salt that sticks together in concentrated urine. You know how a concentrated urine looks like? It's very like a golden brown color. It's no more clear. It has moved from yellow color to like a golden brown color. And kidney stones are found in such urine, such concentrated urine, and they can be painful when passing through the urinary tract. I made a video on urinary tract and also on urinary tract infection. So in that video I was able to introduce us to the urinary tract. So when the urine is passing through the urinary tract, in case of kidney stone, when kidney stone is present in the urine, it leads to painful urination, but usually do not cause a permanent damage. So it means that kidney stone do not cause a permanent damage. So as I said, the kidney helps in urine formation. So it takes waste materials from the blood and makes them to come out in form of urine. So it means that urine contains waste, the toxic materials, the waste materials we have in our system. The urine helps in bringing them out. So sometimes when there is too much of waste in our system, and there is not enough fluid in the blood, so this waste can build up and stick together in the kidneys, and these clumps of waste are called kidney stone. So now we've been able to answer the question how these stones get into the kidney. So when we have a lot of waste in our blood, in our system, and at the same time we do not have enough fluid, maybe in cases of dehydration or someone that is not taking enough water, someone that is not taking enough fluid on daily basis, so it will make the blood to have low quantity of fluid. And when there is low quantity of fluid and at the same time there is high quantity of waste materials in the system, so these waste materials will clump together, they will stick together, and they will build up and form the kidney stones. So now we have different types of kidney stones. We have different kind of kidney stones. We have the calcium stone, the uric stone, uric acid stone, cystine stone. I will not be discussing much on that. So those are the few I'm going to mention on the types of kidney stones we have. And uric acid stones are formed when there is when the urine is too acidic. When the urine is too acidic, that is when uric acid stone is being formed. And cystine stone is made of chemical that your body makes naturally called cystine. So those are the types of kidney stone. So now let's answer another question about who can get kidney stone. Who can get kidney stone? Like the risk factor of kidney stones. Anybody can have kidney stone. Women can have it, and men can also have kidney stone, but kidney stone is more common in men. Kidney stone is more common in men than in women. Now, the risk factors of kidney stone. The risk factor of kidney stone are as follow. If you have the history of kidney stone before, maybe you've had a former history of kidney stone, or someone in your family has had kidney stone before, you do not drink enough water, that's a risk factor, or you follow a diet high in protein, sodium and or sugar, you can have kidney stone. If you are overweight or you are obese, you can have kidney stone. If you had gastric bypass surgery or another intestinal surgery, you can have kidney stone. If you have polycystic kidney diseases or another cystic kidney disease, like a form of of any these forms of kidney diseases can lead to kidney stone. Then sedentary lifestyle, like you are not exercising your body, you are always in a position, you are not moving from one place to the other, you are exercising your body and doing some activities, it can lead to kidney stone. So now let's talk about the symptoms. One of the questions I said we are going to be answering is, does this kidney stone affect the function of the kidney? Now, when we are talking about the symptoms of the kidney stone, we are going to be able to know if the kidney stone really affects the function of the kidney. Painful urination. Anyone that has kidney stone will experience pain while urinating. Another symptom is blood in urine. Another symptom is sharp pain in your back or your lower abdomen. Nausea and vomiting. Blood in urine or frequent urination may occur. You will be urinating more frequent than usual. Then you may have excessive sweating. When kidney stone is formed, they passes through the urinary tract and they can get stuck. Yes, just as I've said before, they can get stuck and causes painful urination. And another question we're going to be answering is, how can we prevent this stone from getting into our kidneys? How to prevent kidney stones? So now, one of the best way of preventing kidney stone is drinking enough fluid every day. Drinking enough fluid every day. I have some people that they do not like drinking water. They are not friends with water, but water is friend to everyone. So you should be friend to water. Learn how to drink water, enough water, not just drinking water. Learn how to drink enough water every day, and at least you should drink about 8 to 12 cups of water per day. So like 8 to 12 glasses of water per day. Then you limit your sodium and animal protein like meat, egg. If just don't take them in excess. They are good for the body, but when we take them in excess, when we take them too much, it can affect and it can predispose us to having kidney stone. Then exercise your body, go for regular medical checkup. At times there are many people that have this kidney stone that they do not know until when the symptoms has when this kidney stone has gotten to a severe stage, and they start having serious symptoms. So when we go for regular medical checkup, it helps in detecting such quickly, and prompt and adequate treatment to be given. So exercise your body. I mentioned sedentary lifestyle as one of the predisposing factors, the risk factors of kidney stone. So when you exercise your body very well, it can help in preventing kidney stone. But the key prevention of kidney stone is having enough fluid, taking enough fluid every day. Don't be a enemy to water, so take enough fluid every day. And this will take us to the end of today's video, to the end of today's health education. If you have any question, any comments, contribution, please, I would love to see them at the comment section. Then if you would like me to discuss one topic or the other, you can bring up that suggestion at the comment section. I'll be glad to receive them. Thank you for watching this video. If you have found this video interesting and helpful, kindly give it a thumb up, and if you have just subscribed to my channel, kindly do that and turn on your notification bell. Till we meet in the next video, live healthy and stay safe. Bye.